COVID-19 is a disease which emerged from uh, severe acute respiratory coronavirus, SARS COVID-2, severe acute respiratory syndrome coronavirus. This is the virus which is responsible for the present pandemic. Pandemic is a disease which affects across all sections of the world. It affects globally, all the continents, most of the countries, and most of the populations, irrespective of anything. So probably this is the first pandemic which you are coming across. And as far as I remember, this is the first pandemic also which has affected Pakistan. There has been other, viral infections in past 2-3 decades, which has affected selected population of the world, like in the one in the Middle East, another Ebola in the Africa, etc., etc. But this is perhaps the first pandemic. It all started, in China. The name of the city is Wuhan. Wuhan is the huge city, bigger than the Karachi in terms of population, where the first cases were identified. Then it spread like a fire in most of the parts of the world. It has affected Pakistan also. But I must say in Pakistan, the damage has not been that much. And there have been effective steps, timely steps taken by the people, taken by the government, taken uh, by the media, I must say, to contain the disease and to prevent the panic among the people. Globally, it has affected many, many million people, and global death is up to about 3.2 million. 32 लाख deaths हो चुकी हैं पिछले 1.5 साल में, started from January till now, January 20 till now. There's a lot of literature. There are 23,000 papers on the coronavirus infection in last 18 months. This is a huge number of papers, and most of these papers lack any standard information and standard guideline, because virus is new, disease is new, treatment is new. So everything is new and is changing fast. So this is how the diseases emerge, and this is how you should be ready to tackle the disease. Pandemic has not only the physical effects, physical illness, but it has a lot of social and financial and psychological impact also. You just see in your family around, in your friends around, in your class fellows around, and you will see that some people have psychosocial issues, some have financial issues, etc., etc. So coming back to the main topic, hematological findings, the hospital has chosen this topic because hematological findings are most commonly seen in patients with coronavirus, as well as the respiratory findings. Other organs are affected sparingly, but let me tell you, there is hardly any organ which is not affected by the disease in one way or the other. In some patients or in other patients, in severe disease or in critical disease. So, but the common systems affected are the respiratory system and the blood system. Now, coming to the symptoms of the patient, there are a large number of symptoms. Anything can happen to any patient. But most patients, almost 60%, 70% patients have either one or two or three of these symptoms: fever, dry cough, and fatigue. Fever, dry cough, fatigue, and dyspnea, shortness of breath. These are the common symptoms which affect about 60% of the people. Diarrhea is seen in 3.7% people. Nausea, vomiting in 3.3%. So at least being, doctors of the first year, you should remember that the common symptoms of the COVID-19 infection are fever, dry cough, fatigue, and shortness. मैं आपको उतना ही बताऊंगा जितना you are supposed to know. So there's a lot of information, and this will lead to nowhere if I start telling you everything. I will tell you the concrete things which are real and strong evidence based. So this is about the symptomatology. Now, what are the hematological findings other than symptoms, which I have told you? Uh, People who have got comorbid conditions, they might have, uh, you know, variable symptoms, or they may have severity of disease just in the early days of the COVID infection. Age is an important risk factor. We have seen, and there's a lot of literature, that old age, 70 plus, is a gross risk factor. Many papers say it is 60 plus. Comorbids like liver disease, like chronic kidney disease, like COPD, any pulmonary disease, like heart disease, diabetes mellitus, patients on immunosuppressive therapies, they are all at increased risk of having complications because of COVID-19 infection. So that is the reason आपने देखा होगा कि जब वैक्सीनेशन स्टार्ट हुई तो पहले हाई रिस्क पेशेंट्स को दी गई, those who were 60 plus, those with comorbid, those, then it dropped to 50 plus, then 40 plus. So gradually the government has covered the high risk population in a graded manner first, and now it is open to 19 and above. Maybe some of you qualify for the vaccine also. And the another good step is that all the teaching and medical staff, the hospital staff, medical staff, and the teacher, whether they are in university or school or college, they are preferentially offered to get vaccinated. This is again a good point to minimize the spread of infection. Now, hematological findings just focus here and here. This मेरा ख्याल है इसको अभी छोड़ देते हैं. Lymphopenia. Lymphopenia means there is decrease in the lymphocytes in the peripheral blood. Thrombocytopenia means decrease in the platelets in the peripheral blood. Lymphopenia is much more common than thrombocytopenia. Elevated D-dimer is much more common. Elevated D-dimer is a marker of coagulation system. The blood का coagulation system है, उसका marker है, and it is highly increased in patients with COVID-19, particularly those who have got severe disease. Similarly, LDH is raised. Similarly, ferritin is a iron compound. It is raised because it goes up in any infection. It goes up in any infection. So it goes up in COVID-19 also. C-reactive protein is another marker of infection. It is also increased. Interleukin 6 is also increased. So they are not specific markers for COVID-19 diagnosis, but they simply tell you that if they are high, that means patient is having a critical disease, or if they are gradually increasing, that means severity of disease is increasing. Lymphopenia, various degree of lymphopenia is seen in early disease or definitely advanced disease में तो ये आते हैं. Anemia is uncommon in COVID-19 infection. So most common is lymphopenia as well as leukopenia. Leukopenia means low white cell count. Lymphopenia means low lymphocyte count. So most common, less common, and anemia is least common. These are the supporting tests to grade the severity of the disease. Another important finding in patients with COVID-19 infection is the thromboembolism. Thromboembolism means there is thrombosis, venous thrombosis, and pulmonary thrombi. Venous thrombosis of the distal veins of the leg, deep vein thrombosis हो जाता है, वहां से pulmonary emboli तक जाते हैं. So they are common. They were seen much more commonly initially in 2020, but there is reduced reports of venous thromboembolism now. Arterial thromboembolism भी हो सकता है. DIC, disseminated intravascular coagulation, is another finding. Patient को MI भी हो सकता है, cardiomyopathies भी हो सकती हैं. But just remember, thromboembolism and pulmonary embolism are seen in patients with COVID-19, particularly those with high risk factors. So RBC and hemoglobin abnormalities, I have told you that some patients may have anemia, reduced hemoglobin, but anemia by far is not a common finding because of COVID infection. Okay. White blood cell abnormalities, I have already told you that leukopenia, yani low white cell count, is seen in 20 to 40% of patients. And इसमें से lymphopenia is much more common, seen in 30 to 75% of the patients. So leukocytosis, yani high white cell count and high neutrophil count, is seen in some cases with severe COVID-19 infection. By far, this is not the commonest finding. Commonest finding is here. So because of this lymphopenia and leukopenia, there is elevated neutrophil to lymphocyte ratio. NLR ratio is high and it has a significance on the disease categorization and outcome. Patients with very high NLR ratio are likely to be more sick than patients where the NLR ratio is not that high. We will see in the next slide. How do the white cells appear under the microscope morphologically? There are some morphological changes in lymphocytes which are commoner than the changes in the neutrophils, because neutrophilia or neutropenia is less common seen. Lymphocyte may typically we see atypical lymphoid cells, which are most commonly seen in viral infections like in dengue fever or seasonal flu or Epstein-Barr virus. सब viral infection में atypical lymphoid cell आ जाते हैं. वही cell atypical lymphoid cell COVID-19 infection में भी नजर आते हैं. So this is about the NLR ratio, neutrophil to lymphocyte ratio. If it may be lower, normal, it may be higher than the normal, but it is not very high. But this is very high. So if neutrophil to lymphocyte ratio is very high, that means severe disease, which means that these are the symptoms which may deteriorate and patient may end up in severe disease or critical disease or ICU admission. Fatigue, dry cough, fever, pneumonia, acute respiratory infection, and organ failure. So NLR ratio is predictor of the severity of the COVID-19 infection. अगर NLR ratio बहुत high नहीं है, that means disease is not severe, patient is probably having mild disease or mild to moderate disease. अगर moderate है तो revert होके mild में आएगा, mild के बाद फिर normal. So these are the findings which are seen minimally in patients with NLR ratio. So NLR ratio predicts the clinical condition and probably outcome of patients with COVID-19. So probably you have seen the normal neutrophils. These are all atypical neutrophils. You see, the normal neutrophil is a cell with 4 or 5 lobes. It is just like this, the normal. This is abnormal ring-like nucleus. This is double-shaped nucleus. This is fragmented nucleus. Again, this is fragmented nucleus. So abnormalities in neutrophil shape, neutrophil nucleus shape are common. This is strap-like nucleus, band form here is second. So these are the findings, but again, they are not diagnostic of COVID infection. अगर ये मौजूद हैं, so you can suspect COVID infection in a patient with appropriate clinical details. Otherwise, they can be seen in other conditions also. So they are not diagnostic. What happens to the lymphocyte? Lymphocyte abnormalities are much more common than the neutrophil abnormalities. They are all just recall any normal looking lymphocyte you have seen under the microscope. They are all activated lymphocytes, large lymphocytes हैं, abundant basophilic cytoplasm है, और they are all atypical cells, atypical lymphocytes. Now, coming to the platelet abnormalities, as I told you, the commonest abnormalities are those of lymphocyte. There may be high NLR ratio. Platelet abnormalities are second most common abnormalities, thrombocytopenia. Secondly, balki third most. Second is the coagulation abnormalities in the form of thrombosis and pulmonary embolism. So third most common abnormalities are the platelets, thrombocytopenia, which is seen in about 5 to 21% of the cases. And it has been seen that patients with platelet count of less than 50,000, unme there is high risk of mortality in patients with COVID-19 disease. What are the causes? Why there is thrombocytopenia? Causes are multiple. Direct effect of COVID-19 infection, of direct effect of coronavirus on platelet production. That means the virus goes and sits in the bone marrow and affects the megakaryocytes, which give rise to platelets. As well as there are antibodies against the platelet, autoantibodies, which destroy the platelets. As well as because of DIC and infection and some degree of hypersplenism, there is increased platelet consumption. So these are the three causes. And thrombocytopenia, severe thrombocytopenia, is seen in many viral infections, but it is less commonly seen in corona infection. And it does predict, if severe, the outcome. Now, coagulation abnormalities, as I told you, these are the second most common abnormalities. First is the leukocyte leukopenia and lymphopenia and NLR ratio, high NLR ratio. Second is this, third is thrombocytopenia, and fourth is some degree of anemia in some severe cases. Thrombotic complications means thrombosis, deep vein thrombosis or arterial thrombosis. or pulmonary embolism is seen in 25 to 30% cases admitted in ICU. Those who have got mild disease, they typically do not develop this because they are put on antiplatelet or anticoagulant more recently. Initially, there was a lot of death because of thromboembolic disease, but then people learned that there is a coagulopathy, DIC, and these patients should be put on antiplatelets and anticoagulants, drugs like heparin, so mortality was reduced. But still, in ICU patients, mortality ranges from something around 15-20%. These are the figures from the initial cases admitted in the ICU. This thromboembolism mainly includes venous thromboembolic events, deep vein thrombosis, and pulmonary embolism, as well as arterial thromboembolic events and ischemic stroke and cardiac ischemia, MI. And in all these cases, elevated D dimer is seen and there is increase in the prothrombin time also. So elevated D dimer is a good predictor of patient outcome. So these patients must receive patients with mild to moderate disease and with moderately increased risk of complications like diabetes or etc. Such patients should be anticoagulated in the beginning of the. So bone marrow effects are almost minimal. Hemophagocytosis, I'll not go into detail, has been seen in bone marrow. But again, hemophagocytosis is seen in many chronic infections, etc., etc. Bone marrow में megakaryocytes may be increased. There may be other findings, but still they are not diagnostic. So bone marrow में कोई ऐसी specific finding नहीं होती है, which can help us in reaching at a diagnosis. So I don't know whether you can see this slide properly or not. I was told that this can be seen. This one picture summarizes the effects which I have told you. If you wish, you can download this presentation from Edmodo, as this one slide will tell you all the hematological findings, white blood cells, coagulation abnormalities, platelet abnormalities, and red blood cell abnormalities. This is sort of summary slide, I must tell you. Now, coming to the literature search, what does the literature say? I have told you there are 23,000 publications, articles in the medical journals in the last 18 months, which is too much. Unfortunately, there's very few articles which are of real benefit because disease is new, treatment is new, nobody knows much about it. There are speculations, hypotheses, अंदाजा है उसके ऊपर लिटरेचर सामने आ रहा है. So you must be careful while reading lot of stuff which is not standardized. There are some of the articles, China का published है, ये Singapore का published है, again China, again China, again China, again China. Since disease emerged from China, so initially in the first half of 2020, numerous articles from China. This is the sample size and the number of patients जिस पे study किया गया, and these are the thrombocytopenia parameters, these are the coagulation parameters, these are the red cell parameters, and these are the white cell parameters. In summary, I have told you what happens to the white cells, leukopenia, and high NLR ratio what happens to the coagulation in terms of thrombosis and pulmonary embolism, what happens to the platelets, mostly it is thrombocytopenia. Red cells are minimally affected. This is what all the papers describe, which I have already told. But if you wish to study some paper for your interest, there are publications from Pakistan. Hematological findings and complications of COVID-19 patients. Yeah, this is a paper from the Europe, France, Greece, Russia, and France. So this is a uh, multi-institutional study, and they have come to the conclusion that neutrophil lymphocyte ratio and platelet lymphocyte ratio may have prognostic value in determining the severe cases. So neutrophil lymphocyte ratio is high in patients with severe disease. I have already told you. And this is about the hypercoagulability is common among hospitalized COVID-19 patients. Elevated D dimer, I have already told you. Thromboembolic disease, I have already told. This is another paper. This is from Pakistan, and it concludes that blood parameters could be used as a suitable biomarker for the prognosis and severity of COVID-19 infections, especially uh, NLR ratio uh, can be helpful to the clinicians in identifying the severe cases of the disease. This is the description of the lymphocytes, leukocytes, thromboembolic system, and platelets. This is another paper from Pakistan, and it concludes. This is published in August 2020. Public patient from Pakistan, ये multi institutional study है. Different institutes are involved. If you want to study one paper from Pakistan, इसको आप study कर लें. The recent paper, August 2020, conclusion: the inflammatory markers like ferritin, like D dimer, like CRP, and hematological indices are a good guide for predicting the severity and disease outcome in coronavirus infection. NLR ratio are elevated in severe disease. बाकी ratio पे मैंने बात नहीं की, it will be too much for you. Just remember NLR ratio. So before I conclude, I would like to talk about the disease. Disease is categorized into three: mild, moderate, severe. Severe can be critical or it can be very severe, leading to admission in the ICU. Most patients who are otherwise adults and fit enough, they have a mild disease like other viral infection and there is auto recovery. Not much. It is like other viral infections. Since it is new, there is a lot of panic. There's a lot of deaths because we do not know about the pathophysiology and treatment of the disease. So the risk is people with 60 or 60 plus those who have got other illnesses like diabetes or hypertension, mortality उनमें high है. There is no specific disease, specific treatment for viral infections typically. Supportive treatment, good hydration, good diet, good immunity, physical exercise, or re- relaxing mood and psychology is very helpful in recovery, patient recovery. Family support is also important. Vitamin supplements like vitamin B complex, and zinc are really very helpful. Good hydration is very helpful. Minimal movement at home is very helpful. घर में isolate कर लें अगर somebody is positive is helpful. You can have oxygen saturation measured at home. Don't be panicky if it is 90 or above. 90 और से नीचे आए तो थोड़ी तवज्जो की जरूरत होती है. Or maybe you will require supplemental oxygen at home also. So severe disease is treated in ICUs or in the HDUs. that is a different story. Again, there is no specific diseases. There are 2, 3 drugs, IL-6 blocker, interleukin-6 blocker drug, or remdesivir is one antiviral drug which has been used uh, successfully in many cases, in many hundreds and thousand cases. But still, we are not sure what is the specific treatment. Secondary infection, secondary pulmonary infection रोकने के लिए एंटीबायोटिक कवरेज इज गिवन एक्सेट्रा एक्सेट्रा. बट रिमेंबर, अगर आप ग्लोबल मॉर्टेलिटी देखें कि इतने पेशेंट को इन्फेक्शन हुआ और इतनी डेथ्स हुई, तो इट कम्स टू लेस देन 2%, विच इज नॉट हाई. बट चूंकि अपनी अपनी कंट्रीज की बात होती है, तो इन्फेक्शन, it appears that the mortality is very high. Few countries had very high mortality like USA, UK, Italy, Spain, India, Brazil. In countries where mortality has been very high. But most countries have controlled, but again, still it is high in India and in Brazil. So thank you very much. In conclusion, the alterations I have told you are significantly more common and prominent in patients with severe COVID-19 disease. The use of serial D-dimer and ferritin and CRP can predict the disease outcome, but they are not diagnostic of the disease. Close attention is to be paid to the coagulation abnormalities in terms of good hydration, movement, and probably anticoagulation treatment in the baby. But that's all. Thank you very much, and I will be happy to answer your questions.
Sir, can we end the session?
जी, session end कर सकते.
Okay, sir. Thank you so much.